Did you know that you could do neurofeedback from the comfort of your home? Well, we're going to talk about my brain behavior reset program and how you can transform your child's nervous system from the comfort of your home. Let's talk about neurofeedback, understanding neurofeedback, what it is, right? Because you may have heard of it. You may have heard a lot of myths. Dive in and talk about what neurofeedback is. If anybody has any questions, just jump in because I want to explain what neurofeedback is. Then we're going to talk about at-home neurofeedback. And I am talking about EEG neurofeedback. There are a lot of different kinds of neurofeedback. And they are all good. They're all valid. I'm not going to smack talk another form of neurofeedback, but certain types of neurofeedback work best for certain conditions. And since the majority of people that I am seeing are really struggling with high levels of dysregulation, have complex layered issues. As much as I've tried every other kind, EEG is the one that I love. I also use, of course, I use PEMF. We have our COM PEMF. And these are all FDA regulated devices, right? So, the quality of the devices are there. When it comes to neurofeedback, and particularly EEG neurofeedback or Z-score training, it really is largely determined by the experience of the provider. So we'll talk a little bit more about that. But EEG neurofeedback lets me target specific areas, and that's important. So let's talk about what it is. So at a very high level, neurofeedback teaches the brain to self-regulate, right? And that's why I'm talking about it in this month, because it's important. It's my go-to tool for self-regulation. And I'm going to talk to you about some cases and you can hear about it. But it takes the brain, it moves you out of that sympathetic dominant state, right? Our autonomic nervous system manages our stress response. And when you're regulated, you're in a parasympathetic state. But when you're in fight, flight, or freeze, which happens a lot to people, a lot to kids, you struggle to come out of that. And what it does is it helps you to get into that state. And when you're regulated, a lot of great things can happen, right? So you can pay attention, your body can heal, you can learn, and know that self-regulation is the basis of all learning. It's the basis of executive functioning, and we cannot learn properly or at all when we are dysregulated. And I know a lot of people reach for psychiatric medication in a hopes that that's going to do the thing, and it often doesn't, right? It can cause a lot of complexities, and that's a whole other conversation. But 100% of every psychiatric medication, including ADD meds, have a toxic effect. And we don't want to ignore that. In today's complexity of nervous systems, we have to look at the root causes of why these things are even happening, right? But right now we're talking about a dysregulated nervous system. And let's talk about what actual neurofeedback really is, right? So it helps your brain to go from that focused, unfocused to alert state to a dysregulated, agitated to a calm state. And it can produce lasting change, unlike medication. And just to know that there are tens of thousands of research studies, 3,000 peer-reviewed studies. And, this is just lots of research, but there's research, as much as 90-something% of people show improvement. A lot of the research is with individuals with ADHD because they're easy to measure, right? So highly efficacious, which is great, right? And it's safe. So what does it do? So with all neurofeedback, with EEG neurofeedback, nothing is coming through the wires. This is me hooking up my man JC, and that's our home-based equipment, and we'll go over what it looks like and how it works. But you are getting hooked up with sensors. It's benign, right? Usually 2 clips on the ear, 1 or 2 spots on the head, and it's measuring. And the way EEG neurofeedback works, and we're going to talk about that process with us, it's a brain map or a brain check if you're fully remote. And then you get your equipment when it's at home. If you're in the center, you come and do it here. But the majority of our people that we work with are completely remote, which is awesome. And you get my experience of having worked with thousands of people and done over 10,000 brain maps, right? It's very different. Remember, the determining factor of the success of neurofeedback, aside from you actually doing your sessions, is the person doing the protocol and monitoring your program, right? And our program, everyone always asks, like, this is not just neurofeedback. We do a 6-month program. We're going to talk about it. It's way different than what most practitioners can do because they don't have the experience that's integrative, the knowledge of the behaviors, and how to work these things together. And we put it in what we call our sweet spot, the amount of time that it takes. Remember, I'm going to get my magic wand. There's no magic wand when it comes to mental health and mental wellness, right? Didn't happen overnight. Even with PANS and PANDAS, by the time you get to me, it's not going to remedy overnight. And anybody who tells you something different, including your psychiatrist, is full of baloney. So the brain gets reinforced for producing a healthy response. How does that happen? What does that look like? So with our EEG, we're using a computer, and that computer is measuring, right? I've set a protocol. I've said, hey, the brain is going to get reinforced when it produces the exact perfect combination of brainwaves. And guess what's so cool, you all? It does it in 2 to 3 seconds. So it goes from this dysregulated state to a regulated state. And you can think about it just like working out. You get on a treadmill and you're able to walk, right? And you might even be able to get up to, your first session to a 2.0, right? Maybe a 3.0. Maybe you run for 30 seconds, but you can't do it and for the whole time, nor is your muscle building. So it's going to reinforce that brain to go from a dysregulated state to a regulated state. And that's going to happen over a series of sessions. Most people are doing about 40 sessions. In our program, we do 40 sessions. Some people do more. On occasion, people do less. Please don't think it's, people always want to ask me, why can't I just do 20 sessions? The brain didn't get into the state overnight. It needs reinforcement, right? Why can't you just work out 20 times and be a size 3? It just doesn't work that way. You need a comprehensive approach, right? So that's why I equate it to working out, and many people do. So you're going to get reinforced to produce a healthy combination of brain waves over time. And the brain, wants the reinforcement, will change itself. And it's so amazing because not only does it start regulating brain waves, it increases neurotransmitter activity and even actually changes the structure of the brain, increasing the brain's gray matter, which is those all important frontal lobes, which is, where a lot of important things happen. It's our job manager. And this is what a session looks like. This is our actual equipment. It encompasses a computer and a device, an encoder, and it's so easy to use. The software has gotten incredible. Again, I'm a huge fan of EEG neurofeedback, having tested them all, because I know it works. It works for complex cases, and it can be done at home. And it has been for the better part of a decade. And that equipment has gotten great. So what is our process? How do we make it work? Because there are people, and just know there's all kinds of devices. So there's, the headband, there's stuff that has the word neuro in it, but it's not neuro. It might be biofeedback, all good stuff. Very much geared towards stress reduction. So if you're looking for stress reduction, these devices are great, right? They're not controllable. You can't target things. And we'll talk about some of the cases that I have, just to help get a sense of what it's like, right? And know that neurofeedback can be used for a variety of conditions. So it can be used for complex cases in, the hands of a very skilled practitioner like myself. I have kids with like PANS, OCD, depression, all at the same time. Throw a little dyslexia in there. It can be used for, like we said, our sweet little dyslexics, right? Because I got one of those. It can be used for TBI. There's lots of evidence to show that. And again, everything I do is evidence-based. So this is a great question, and I'm going to answer some of these questions about, can it be effective while still fighting the environmental toxins of PANS and PANDAS? That is a heck yeah. So everybody knows I specialize in PANS, PANDAS. I actually am the only person in the international board who's ever done a training about neurofeedback for other providers. So when you're going to a provider said they've done the training, they did my training. So I'm the trainer of the other people. So just so you know. So, and a lot of our cases are PANS and PANDAS. So why does it help? Why does it help when you're fighting an active infection, right? So many people who come to me with PANS and PANDAS are in different stages. Sometimes I get people new who literally haven't even gotten to a medical provider. They're not sure. And then I am not a medical provider. I am a mental health provider. So I connect you to a medical provider who can do the medical treatment. So that's important because everyone always asks that. Yes, I give support around supplements and things, but you need a medical provider. Then I get people who are in the raging part of it, like extreme. A lot of those people do intensives with me because we do 2-week intensives to jumpstart. Not going to fix it, but to get that nervous system regulated. And then the last part of people who are like anywhere from 60 to 90% better and really want to go as far up as they can. And some of that, and they, dress the infection, they're getting good care, those kind of things. So how does this help? So my statement earlier may not have been clear. The body cannot heal itself in a sympathetic dominant state. When you are stress activated, no healing is going to occur easily or at all. And it is why so many people with PANS, PANDAS, Lyme disease, head injuries, come to me because there is that barrier. And sometimes it's a trauma. It's literally been a trauma response where the nervous system is activated. Sometimes it's just chronic stress. Sometimes it's just the nervous system getting activated because of the healing response. But until we regulate it, we don't get full healing. And it's why I get good results, right? But it is not in it by itself. It's a multi-pronged approach. And go back and listen and watch all the stuff about my PAN stuff because I talk about the 5-pronged approach to healing. So let's make that clear. No magic wand. But, for people that do my program, they get results. The people that don't properly do the program don't get the results. It's like anything else, right? Just like that treadmill in your living room or your basement. If you're not using it, it's not going to work, right? We have to actually do what's going to work. So let's talk about what our program looks like so you get a sense of it and how it can help you. So what we do in our program is very different. I have a trademarks program, and it starts with a brain map or a brain check. And a brain map is in person. People like to come in and fly. And I do consults, right? Where I do consults, a one-time consult for somebody and create a care plan for you because I have people from all over the world and not everybody can come. I have a big Australia contingency. Shout out to my Australians who really try to take care of themselves, even though my bestie's in New Zealand. Australia is a little better, Shelley. So, and then I create that care plan. If you're doing at-home neurofeedback, we send you the equipment. A lot of people do our PMF. Somebody has a question of, do I use a beamer? I don't use a beamer, nor do I feel that it's beneficial at all for my people because it's a general use PEMF. So a lot of general use PEMF. Go back and listen to the other things, but ours is custom designed by me. The protocols are tested by me for 8 years before I did this. And they're designed for very specific things, anxiety and stress. There's also an OCD component in that, PANS and PANDAS. The infections and toxins that's designed for detoxification, stress. There's an OCD component in there, obsessions and compulsions. And then I have a learning attention one, which is awesome too. It really jacks you up. So we do our sessions, you get wellness coaching, we do data collection, we do lots of adding of what we call brain keys, lots of education to really help. And the first part, those first 20 sessions, is really about calming that freaking nervous system down, because nothing is going to come into place until you calm it down. So many people come to me seeing dozens of providers, and it's really truly because nobody is regulating that nervous system. The provider is great. You might have a great therapist, you might have a great medical doctor. And a lot of my referrals are from medical doctors because they're stumped as to why their client isn't getting better. And it's because of that stress activated nervous system. And I already gave you the examples as to why that happens. So here's somebody that had ADHD before and after. Just know blue means low activity, green means normal. This is like an incredible amount of progress that this person had. They were able to focus. We were able to almost completely normalize their focus, which is that fourth brain map over. That's what's called beta. It's a focused brain wave, can be really telling. This is a PANDAS client, right? So this is somebody that was incredibly activated, and was, struggling with mood lability, had mold and had every infection, had all these components, and was just so activated. And until I got them, as this person said, need to make them more parasympathetic, until I got them down in the parasympathetic, they had a great doctor. They just couldn't get better. So we need to regulate that nervous system in order for a person to get better. This is somebody, very complex case, very extreme case, one of the most extreme cases of PANS and OCD I had ever had. And we actually had to get them to do PEMF before they even got to me. And was not just housebound, room, couldn't get out of the room for a very long time. And what had happened is COVID had shut off his brain. That's what blue is. Nothing was kicking on. And he developed just extreme OCD. So extreme, couldn't go anywhere. With this, we were able to normalize his brain functioning, and he didn't, it was just an awesome change for him and his family. And he's doing really, really great. This is somebody with a mood disorder that had a lot of what we call hyperconnection in the brain. What's great about neurofeedback and EEG neurofeedback, you can directly target anything, that brain communication, the brain structures. So that is why it is so powerful. Somebody said, how long is it good to be used for? So I think there's two possible questions here. So one, how long do you need to do it? So we do a 6-month program in our brain behavior reset because we know that's how long it typically takes. This program can easily be done in 4 months. We put buffers in because I have a lot of people with complex issues, and sometimes they need to, take a week off, or they have a flare, or somebody's having a hard time, or there's exams. The other part of that question is, how long do the changes last? So what we know through research is that when you do neurofeedback, that the changes, when they've tested you 6 months, 1 year, 3 year, and 10 years out, that you sustain the changes. And in fact, your brain tends to get better over time, which is so amazing about neurofeedback. Unlike our psychiatric medication, it really can create that lasting change over time. Now, let's be honest, right? You have to take care of yourself, right? It's sort of like, it's like the Oprah, the first time she lost weight, she did that for any of us, babies of the 70s and 80s. When she came out with all the 67 pounds of fat, she said she already started to gain weight because she got off she was doing a liquid diet, right? And she got off and she already started to go back to her own ways. You have to moderate stress. Once you're prone to anxiety, you're prone to depression, you have trouble processing, your nervous system is more sensitive. So this is an aha moment to tend to your internal garden, and you can't run on empty. I mean, Dr. Rowe knows this. I mean, I burnt myself out in 2023 and had adrenal burnout. So you have to take care of yourself. You have to adopt ways to mitigate stress. So once you've gotten that beautiful, it's like you don't just get a car and say, I'm never washing it. No, you're going to take care of it. So it's just a lot easier when you're regulated, and your health will improve, and it's a much, much better process. So, people do very well with at-home neurofeedback. Our program is designed to support you, keep you on track, have accountability. Again, I'm a huge fan of EEG neurofeedback. I practice it because it's super effective and I can target real concrete issues. And I don't want people, thinking, that the other plug and play tools are bad, but they really are just designed for stress relief. So if you have a little anxiety or you're looking to improve yourself, a lot of my people will use other devices post-program just to keep themselves, right? So our PEMF device was designed to support people within the program, post-program, before program. I use it every day. I used it this morning. So somebody's asking which home system we have. So, I mean, we use a specific program that is EEG based. And our home equipment and our in-center equipment is different. And not every, that's something we talk about with people that are going to use our equipment. Remember, every piece of equipment is FDA regulated. So what happens with inexperienced providers is they like to talk about their equipment because they don't have experience yet to talk about the efficacy of their skills in supporting their clients, right? The benefit of working with me, and this is a question people ask all the time, like, why would I work with you versus your local provider? You're getting somebody who has 30 years of clinical experience. What I can do in 2 or 3 minutes, if you're listening to my podcast, people have to go and do hours worth of research. So you're able to get in there and get working quickly, right? Now, a lot of times what I have to do in our program is get mom and dad on the same page because usually we're not seeing the problem the same way. I also have to get moms to trust themselves, and because there's so much worry. And we have things in place for that. And know that we accept people into our program. I only work with a small amount of people every month, and it's shrinking every year. And I'm not afraid of the problem. I'm always afraid of your attitude towards the problem, right? So this is something we do in tandem to support people, and everybody can get better. So somebody's asking about, some of the common questions that we get are, how long are sessions? So when we are talking about ages, so neurofeedback can be done for a 3.5-year-old and up, right, of people in their 80s. Sessions are typically 20 to 30 minutes, but somebody like a 5-year-old, it really depends. I don't know what a 5-year-old, we have to evaluate how long they can go. You're going to get a benefit after 5 to 8 minutes, but I don't want people, I want people to be ready. So sometimes, again, because of the skill that I have, we're able to help assess that. Also, sometimes we pre-program initiatives to regulate the nervous system even before they get started. We do that all the time. And we're also super experienced with brain maps with dysregulated kids. I mean, that's kind of our norm. And a lot of times people are completely freaked out. I recently had somebody go to a provider out in California, and they told them that they needed to be medicated before they did neurofeedback. And the mother was like, well, isn't that why we're here? So we don't do medication. I also want to just say about neurofeedback, the equipment at home is as efficacious as in center. The software is amazing. So it is not less than, it is equal to. The biggest problem with at home is just making sure you're sticking to a schedule. But again, as part of our program, that's just what we do. We have a great program. And people always wonder, like, will my kid comply? Will they not? Kids comply. It feels good. I've literally now had one person ever in these decades refuse. And she ruined my record. but she was doing it. It was really a conflict between her and her mother, and I'll leave it at that. It works beautifully with other holistic treatments. When you're doing neurofeedback, you shouldn't be adding psychiatric medication. That's between you and your provider. And you can be on psychiatric medication if your brain will allow training. Again, if you're on psych meds, get yourself a darn good qualified provider, because it's not easy. I have lots of people who've tried neurofeedback elsewhere who come to me. I would say that's probably 20% of at any time. And that's because they believe it works. Typically it was a wrong kind of neurofeedback. They might have done, always my more complex cases, they might have done lens, they might have done Z-score training, and it just didn't work for them. And it's because their brain is complex and EEG can target it. People are doing 2 to 3 sessions a week. Some of my intensives are doing a lot more. Again, the research is amazing. People always ask, if my kid is super dysregulated, should I start? Why would you wait? I mean, unless they're going to throw the equipment, get them in. I mean, I have lots of autistics. I mean, I have lots of kids that are really pretty, dysregulated. So it's a matter of doing it. So are there side effects? So side effects, the research says there's very limited side effects. And when side effects typically happen, it's a slight worsening of symptoms. It has a lot to do with the quality of neurofeedback you're getting. I'm so experienced that I can tell you that you're in a category of that. Also, some of my parents, were making such progress that we want to make some really aggressive moves, but that's just between me and that family. And I let them know, like, hey, we're going to really try to get into this one area, but this is like a 50-50 shot. And so, we work that out amongst us and helping that. Somebody's asking you to provide therapy along your program in neurofeedback. So in our program, it is coaching. If people want to do psychotherapy, we do a lot of ERP for OCD. That is additional. That is an add-on beyond. It is not, psychotherapy is not included. And psychotherapy is, we are in Connecticut and we have licenses in New York and Connecticut. We have therapists who are licensed in those states. So we only can provide it in there. But we do parent coaching as an add-on as well. It really depends, but it is not included in our actual program. It's really about neurofeedback, lifestyle changes in there. So somebody's asking a question. Oh yeah. So somebody's saying they've done a brain map. He's in college. Do I accept other QEEG brain maps? So I do a consult. So I do an educational consult. It's a one-time meeting and I go over it and I look at it. You're not so far away. I have a lot of Jersey people. Deb. I have a lot of Deb friends, by the way. Some of my best friends are named Debbie. Great name. But call and let me just make sure I put this in here. The best way to get a hold of us is to go to drroseann.com/help, and you'll be guided through a solution matcher, which will eventually lead you to an application. And we guide you to that right solution. But yes, so I do consults for professionals who refer to me and get you treatment plans for your clients. But I also do them for individuals, and we do that. So if I didn't feel like it was a good brain map, I had concerns about it, I'd let you know. So, it's like what happens when you go to somebody who's super nerdy and just loves what they do. I'm only going to, recommend the highest and best. And that's why people come. So this was great. Here's your top takeaways about neurofeedback. It is highly efficacious. It regulates the nervous system. You need to commit to 2 or 3 times a week. Our program is unique. Somebody's asking really specific questions about are there different areas? So it doesn't matter if it's autism, it doesn't matter if it's PANDAS, it doesn't matter if it's ADHD. Think about the brain as, is it understimulated and overstimulated? You do target specific areas based on clinical symptoms. I don't need a diagnosis. Yes, there are clinical issues that are more common, and there are brain patterns that are more common, right? In a brain with autism, looks like a brain with autism. So when I do a brain map, it is a diagnostic assessment. So you're getting my insight, having done, thousands of intakes, neuropsych testing, all that experience that comes with it. And it is not a 5-minute checklist. You're doing checklists, you're doing an intake with me, and you're doing that brain map, and you're going to get some Dr. Rowe insight onto what the problem is, and how to work it out. So I hope this has been enlightening. I think it's a powerful tool. And again, at-home neurofeedback is as effective as in center, and I love it. I think it's incredible. I waited a very long time to start doing at-home neurofeedback, which I started in 2019, right before the pandemic, so that software got so great, right? And so we can monitor, we can see what's going on. So, but when you work with us in our brain behavior reset program, you're really getting access. Yeah, you're getting Dr. Rowe guiding your program. You're getting a brain reset specialist. You're getting guidance, and you're getting that insight into the path. But you are doing the heavy lifting. You are, doing your sessions. And again, neurofeedback is not a one and done. There are lifestyle adjustments that have to happen. You can't keep doing the same thing, add one thing and think it's something different, right? So if your kid isn't managing stress, they need to find new ways to deal with stress, right? And if the resources we provide you that are for you to use on your own aren't enough, you can add on therapy, you can add on coaching, and there's lots of paths to get there, which is pretty darn cool. So somebody's asking me, can I tell if a child has PANS and PANDAS or autism? So when I do a brain map, again, because I've done over 10,000 of these, this is not typical of a provider to be able to do this. Most neurofeedback providers are not doing their own brain map analysis. They are sending it to a company. So probably 95% of practitioners are sending off their brain maps to be evaluated elsewhere. So there's nothing wrong with that. But when you're coming to me, it's a diagnostic assessment. It is not just a brain map reading. So yes, certain patterns are very clear. Now, I can't just say you have a brain map that looks like autism. It has to be substantiated with that clinical intake and further, right? So sometimes it's like, wait, we need deeper analysis, or let's get your therapist eyes on ruling things out. PANS and PANDAS is pretty easy to spot on the brain. I got 100% accuracy, and I send you to a medical provider to find out what those infections and toxins are so that they can be addressed, right? If you don't already know. And even though I'm a PANS PANDAS specialist, I don't believe everybody's got it. I'm going to tell you what I think it is. And I can promise you that the majority of people who get a brain map with me actually, I would say 50% of them have misdiagnosis or are missing diagnoses. ADHD is a perfect example. Seems like everybody's diagnosed with it, but definitely more than half the time, it's not the right diagnosis. So you're getting a comprehensive insight into what the brain is doing. And it's pretty easy to see in the brain what a person can and can't do. So I love a brain map. I love that diagnostic piece. But when you're coming to me, it's so much more than a brain map. And it's hard to, explain. I always try to explain it like, why does somebody get like a second opinion? Like, I remember all these years ago, my dad had cancer and, we went locally and the local Yahoo guy was like, you're going to be dead. Literally. I was there. He was like, you're not making it. You're 99.99. You're going to be dead. And it was like, what? And my dad was only 60. You got to know Tony. He's a hot ticket if you know him. And we were like, we're going to the best place in the world. So we went to Sloan Kettering. And he's alive. He's 85. They were wrong. So you go to places that have clinical experience. We saw the head of Sloan Kettering in that division. So that's what happens when you go to experienced provider, right? And you just can't replicate that. So yeah. So somebody's asking, can you be, have autism and be, diagnosed as autism and have something else? It's often the opposite. that they're diagnosed with something else, and it is autism, just so you know. So many people get diagnosed with ADHD because there's still a lot of lack of understanding about autism across the board from providers, and especially when we have kids that have good cognitive skills and are good pretenders. Have I ever seen somebody diagnosed with autism and they have something else? Yes. It's almost exclusively PANS and PANDAS. So PANS and PANDAS can make somebody look autistic, and there is a real overlap between the two where people have both. They say that about a third of autistics also have PANS and PANDAS. So it's much rarer in what you're asking. I'm finding it the opposite. We are missing autism. So with 1 in 27 boys being autistic, and it's, and in the next decade, it's going to be 1 in 21 births overall. So we're just not catching autistics quick enough. So lots of great questions. I hope this was, again, we're going to monitor the chat. And if you want to work with me, go to drroseann.com/help, and we'll match you to the right solution. And I'm so glad you're thinking about ways to self-regulate that are natural and safe and lasting, so that there's not a whole other worry for you about, what else are you doing and harming your kids. And neurofeedback is just a wonderful solution that's been around since the late 60s. And I'm so glad you're learning about it. So wherever you are on your journey is exactly where you need to be. And I hope you are feeling like a more confident parent, and that this was just an eye opener for you today.